Hello everybody, my name is Dr. Chaudhary. I'm a third year psychiatry resident with Texas Tech Permian Basin. Today I will take a minute to talk to you all about the topic of who is at risk for suicide. Unfortunately, suicide is a reality in today's world. As we talk, we are losing one person every 11 minutes to suicide, which is close to 46,000 deaths in the past year. So how do we identify who is that one person who is at a higher risk for suicide? So the risk factors of suicide have been researched to be many, and they all can be divided into four categories. The risk factors at the individual level, the risk factors at the level of our relationship, risk factors at the level of our community, and then as a large, risk factors at the level of society. At an individual level, it has been researched that those who suffer emotional trauma in the childhood, or those who have a history of a past suicide attempt, or those with chronic mental illness, or those undergoing financial or legal stress, they are at a high risk of falling victim to suicide. At the level of the relationships, ones who are struggling in the relationship, whether it's with their loved ones, other family members, in the form of a marital dispute, family discord, they are at a higher risk for suicide. At the level of community, there are some communities where the stigma of mental health disorders is high, where it is not easy for everybody to open up, or there are some communities which have been marginalized and discriminated against for a long time. Members of those communities are researched to be at a higher risk for suicide. And ultimately, as a level of a society, those who do not have access to adequate health care, not having access to mental health care because of financial or insurance region, lack of awareness in the community, they are also at a higher risk for suicide. So these are the ways by which we can identify the vulnerable population. What needs to be done is to extend a hand of support. There are excellent resources. My favorite of them is the new helpline, which I would like to talk to you about. It's 988. I'll repeat, 988. That's a fast dial number, just like we use 911, but it is exclusive for mental health crisis and suicide, which we can reach out to seek help for us or for our loved ones. Stay tuned with our channel. We will have an extensive seminar on this topic in the coming days, so that we can talk more about how we all can collaborate as a community to take care of this. Thank you.